Hey everyone, this is J-Dog and I'm here with an important video. So there's biases, racial bias in healthcare. There's an algorithm that is racially biased against black patients. There's also a public health issue involving racism. Let's start with this article right here from Engadget.com. So basically, now remember when I talked about an algorithm, I was talking about how social media algorithms have been racially biased against black accounts, whether it be on Twitter, YouTube, especially YouTube. There's been a lot of algorithm issues. People are not getting notifications, and etc., etc. So now there's an algorithm in healthcare and medical fields that is racially biased against black patients, and it's been reported. Underestimating health needs for black patients. There is more evidence of algorithms demonstrating racial bias. Researchers have determined that a widely used risk prediction algorithm from a major but unnamed healthcare provider has a significant racial bias. While it didn't directly consider ethnicity, it emphasizes on medical costs as bellwethers for health lead to the code, routinely underestimating the needs for black patients. A sicker black patient will receive the same risk score as a healthier white person simply because of how much they could spend. The difference were sometimes acute. Scientists reckoning that eliminating the algorithm bias would increase the percentage of black patients receiving extra help from 17.7% to 46.5%. When millions of customers were processed through the algorithm, this meant that legions of black people weren't receiving enough support. So this algorithm, and you know this was done purposely, was created to undermine black patients of Medicare providers and such, and medical fields and such. In this case, the bias appears to have largely been ironed out. The team helped the healthcare provider switch to alternative labeling such as active chronic conditions and avoidable costs, putting the focus on the actual health of the patient instead of their costs. This helped reduce the quantifiable bias by 84%. While changes are far from the only ways to address alleged allegations of systematic bias, the studies suggest that they could play a larger role than you might think. So this is one article talking about a bias algorithm that's affecting black patients. Now, I said I wanted to talk about racism being a public health issue. Well, this is why we're going back to the Atlantic Black Star. So, Atlantic Black Star from Tanisha Kinney talked about how a city called Madison, a Wisconsin city, has signed a resolution declaring racism as a public health issue. The Madison City Council is the latest to join Wisconsin's Public Health Association's 2018 resolution declaring racism a public health issue. And here's why. According to the Badger Herald, city leaders signed the resolution October 15th, joining 35 other groups, including the city of Milwaukee, that have gotten on board. The proposal was sponsored by 20 council members, including Madison Mayor Sentai Satyai Rhodes Conway. This is a black patient who's in poor health, and racism has contributed. According to this, they're talking about how racism, or being the victim of racism, has contributed to things like high blood pressure and black mothers with babies being born with low birth weight, not rate, weight babies, meaning that the baby is born lightweight, underweight. The push for racial equality comes amid to growing bodies of research pointing to racism, negative impacts on communities of color, and particularly black people. In September, roughly 67,000 doctors with the American Association of Pediatrics released a policy statement acknowledging the effects of racism on health outcomes and suggest steps healthcare providers can take in combating it. Our setup is to produce chronic toxic stress, said Janelle Heinrich, Director of Public Health Medicine in Dane County, and it's actually having an impact on our health. In May, Milwaukee City Council Executive Chris Abel made clear his community to progress by signing the WPHA anti-racism resolution. Abel is a Democrat, and the motion was about making a public promise to take action in the face of injustice. So far, let's skip over a little bit and let's talk about what researchers found. Researchers found that babies born to black mothers were twice as likely to be born underweight those born to white mothers. Moreover, the studies put black infant mortality at 15.4 deaths per live birth, more than 2 times the overall infant mortality rate for Wisconsin. We are seeing across the board in our communities of color, especially in our African American communities, negatively desperate rates of low birth weight, infant mortality, later diagnosed of cancer, leading to higher rates of death, and lists can go on, said Heinrich said. Racism's negative impacts of parts of healthcare industry as well. Last month, the report found that a widely used algorithm, we just talked about that in the previous article, to determine which parents are seen first at hospitals shows significant racial bias. Or we at least told something similar to that in a previous article that we just talked about on this video. Authors estimate that this racially biased reduced the number of black patients identified for extra care by more than half. I do want to bring up something else. You know what's also is affecting black people's health? Lack of black doctors. I also did a video on an article or news report on NBC a while back. If I could find that video, I might, or as this video is being posted, you might see that link in the description box and comment section if I can find the video. If I do find the video, it will be linked in the description box and comment section. And it will be about a video where there's been a lack of black male doctors could lead to poor health amongst black people, especially black men. And this probably could go the same for there being a lack of black female doctors. But the news report, on the video I did on that news article / news report, was focusing morely on black male doctors. But like I said, black doctors in general, male or female, if there's not a lot of people in the who are like us in the black community that is in the medical field, whether they be paramedics, dentists, vets, I mean, this is for pets, by the way, doctors. If they're not doctors, a lot of paramedics, a lot of dentists, a lot of people in the medical field that are black, then this could have an effect on black health, because there has been reports of doctors of other races have been racially biased towards black patients. So that's what they also not talk. They may not be talking about it, but this is another thing that's affecting the health of black patients, and this could be a very big health crisis towards the black community. And believe me, this is done by design by the white supremacists. They want to basically make us so unhealthy to the point that our entire race as a whole dies from it, eliminating and causing depopulation. That's why the racists are happy to see black babies born unhealthy, because they believe that this is a way of depopulation. That's why we need more of us in the black community to be involved in the medical health field. We also need to decide on creating our own clinics, our own urgent cares, own hospitals, own health insurance companies. Black people are going to have to start doing these things now, creating our own stuff in the medical field in order to fight against this racial bias towards black patients. But I will leave the links to these two articles that I just read to you in the description box. I might also link to that video I talked about the black doctors, a lack of black doctors, also in the description box and comment section. This is a really serious issue that could be affecting our community. Speaking of the comment section, I want to know what you think. I really want people to share this video with everyone as much as possible. Make sure you also like the video. That helps with notifications. Make sure you subscribe and hit that notification bell. Check every once in a while if I'm doing a new video or post or not. And then also I'll leave a link to different accounts that I want people to follow me on, whether it be on YouTube, Black Junction, Twitter, Black Shares, etc. I will also have those accounts. But we really need to think about this. We really need to think about this. But that's all I have to say for now. This is J-Dog. Thank you for watching, and I hope to catch y'all in another video. Peace, everyone.